So, ma'am, one more question I would like to ask is that is the most we can say the destructive outcome of some of the mental health issues, like not always the mental health issues, but sometimes people usually commit suicide or something like that, or try to commit suicide. I have seen in my friend circle some persons who try to commit suicide, who try to hurt themselves because they are not able to live the way they want to. So why is it like that? How is it that much dangerous that people usually try to end their life? And how can we prevent them? How can we support such people so that they can continue their life and they can make it better? How, as an individual, we can play a role in it?
Uh, Now, suicide is it's defined as an intentional, self-inflicted act, okay, that results in death. While there's a difference when we speak about suicidal behaviors, that is, it's not considered basically fatal, and more commonly, it's called the suicidal attempts, right? And it is an intentional and a very repetitive behavior wherein a person starts harming themselves, right? And it's not socially condoned as well. And but there is no standard suicidal intent that comes in, so there's a lot of difference across the terms that we use. But suicide is a very serious condition that we should be talking about, because it is also considered to be the ninth leading cause of death as per the 2016 records that came in, okay. Of how this happens is that there is an idea that arises in the person's mind, and it doesn't subside. And when it doesn't subside, at that period of time there is a suicidal desire, an intent that comes in, okay. And that's when the person tries to attempt suicide. Now, when the person does not, like, it doesn't lead to death, it's not completed, it's not, it's called a attempted suicide at that period of time. Only when a death occurs will you call it as a suicide at that period of time, right? So this is how the entire process happens. And most of the times this occurs because this particular situation must have been too difficult or too much for them at that period of time. Like they must have tried everything, tried to, like, put in whatever strategies that they thought, and in the extreme scenario where they feel that they are not able to cope up with a particular situation, and that's when they take the decision at that period of time. Now, what can we do is a very important question that I think all of us should ask and should contribute towards it. The first and foremost thing is never discount the feelings. When they are actually opening up their mind, or their thoughts to you, it should be considered as utmost serious and important. Their perception should be understood at that period of time. Second is, suicide is a cry for help, so we need to it's the indication of their emotional pain, and hence we need to focus upon it. Third is, try being a good listener. If not for anything, just like, that listening can ease off their burden itself, that pressure cooker feeling that they've been in. You just sit down and spend some time with them, it'll really ease their burden itself. Fourth is, encourage them to get help. You Professional assistance is there, encourage them to do that. And don't be afraid to ask them about their suicidal feelings. I mean, it is considered as an opportunity to understand itself, checking upon them, right? Now, another thing to keep in mind is, if you think that your friend is in danger, do not leave them alone. It is very important for you to keep that in mind, because they can have a danger in terms of hurting themselves. And encourage them, like I said, to seek a mental health professional. And if you feel that someone's telling you to keep a secret that can kill your friend, that secret should be broken at that period of time. If we can put in these things, I'm sure that we can work towards preventing suicide.